Good morning, everyone. My name is Tim, and I'm the Palliative and Supportive Care Education Manager here at Cancer Council WA. This is the first time that I'm hosting Keeping Up with the Pace, and you may have noticed that Claudine's voice is a little bit different, but that is, of course, because I'm not Claudine. She has accepted another position within Cancer Council, and I have joined the team as of April. As we start off all of our meetings, I'd like to do an acknowledgement of country. So, in the spirit of deepening relationships, Cancer Council WA acknowledges the traditional custodians and owners of the country throughout Western Australia and where our esteemed guest is, and recognise their continuing connection to land, water, community, and we pay our respects to the elders and extend that to all Aboriginal people working and living in this area and in the area of our guest. So, our guest today is a very accomplished, and we're very privileged to have Dr. David Sykes join us today. He's the director at the Centre of Dementia Learning at Dementia Australia, and he studied an undergraduate degree in social work with a graduate diploma in organisational behaviour before later completing his doctorate in social work. So, from across the Nullarbor, we say hello to David.
Hello, Timothy. Hello to your listeners, and thank you for the opportunity to be part of today's podcast.
Thank you very much for joining us. As I said, it's not often we have someone as esteemed as you, David. So, thank you very much for taking the time.
Conducted a report to look at the extent to which our community's attitudes towards people living with dementia have shifted or not. And we've done these reports over the last decade, and look, sadly, this one continues to reinforce the level of stigma and discrimination that people living with dementia to continue to face on a daily basis, and those caring for them. And one of the saddest things that is reported to us by people living with dementia is that one of the first major losses post-diagnosis they experience, or as the development of the condition progresses, is the loss of their network of friends,
Mm,
which is tragic when you think about all the things that they go to be confronted with on their dementia trajectory, and to not face that with friends, often because friends feel awkward or uncertain about how to interact, or they're taken in by stigmas around dementia and thinking that people are going to act out or, behave violently, or a lot of um, those myths that are out there in the general community, or that they're just not sure how to interact. I think, there's one of the saddest things about that. So certainly this year's Dementia Action Week, we're actually calling on everyone across the community, including government, and all of us, to see how we can do more to raise our respective awareness and understanding of this condition, um, and make our communities more friendly and inclusive of people living with dementia. And we see some good examples of that across the country, but just more needs to be done. And I think at a government level, we're certainly calling upon the government to release the National Dementia Action Plan, which we've contributed to, and others, that sets a 10-year plan for what we need to do as a community, in our health system, in our aged care system, and more broadly, to make this a society that really does support people living with dementia. Because if there is that sort of stigma and discrimination, as our report has highlighted, and the World Alzheimer's disease report also reinforced this, that was released today, that with that stigma, people are more reluctant to seek a diagnosis, more reluctant to seek treatment, and the cascading effect of having that level of stigma and discrimination.
mm, yeah. And it's such a multifaceted disease, David, in that, as you rightly said, there's that intense isolation, but there's also the social awareness and understanding of that. And unfortunately, as you are well aware, that the reduction in interaction, not being cognitively active or seeking out communication can exacerbate the symptoms and increase the progression. Is that right, David?
You're spot on, Timothy, and that is exactly right. One of the things we encourage in the risk reduction space is keep socially active, keep connected, because all of that continues to promote cognitive functioning as best as you're able, whilst the condition continues to have its effects. So, if people are being isolated, then it does have the potential to accelerate the progression of the condition.
Yeah, which is terrible for everyone involved, not just the person living with dementia
Absolutely.
diagnoses, but all of their
Absolutely.
existing networks around them. So challenging. So
So much of that is just through fear and misunderstanding, or fear and ignorance. So, it is something we can all do something about. And, there's a wealth of resources out there. We've got a heap of resources on our website that people can access, and programs that people can access to find out more. So we really encourage people to take a greater interest in that, because chances are there's someone in all of our networks of friends or family who has dementia or is developing it.
and one of the things you touched on earlier, David, that I was particularly interested in is that you said there was uh, the loss of independence, loss of self. But one thing that struck out to me is, if we're talking about types of dementia, is the early onset of dementia, and how that is also going to become problematic along with the increasing dementia diagnoses across the nation. But we're seeing a higher prevalence of early onset dementia as well. So it's affecting an even broader population of Australia. It's not considered horrible, quote unquote, old person's disease. It's going to affect everyone in the whole gamut of life.
Yeah, look, you're right. And one of the common myths around dementia is that it's a natural part of aging, which of course it isn't. But that was borne out in the recent Alzheimer's Disease International report as well, that there was a strong view of that. And what was probably even more concerning was that something like 68% of health professionals thought that. So the one group of people you thought should actually know better about that don't. So if they've got that view, you can hardly blame the broader community for feeling that that's the same. But you're right, we do have, sadly, people in their 30s, 40s, 50s, and 60s have developed dementia in that younger onset category, and a lot more work also being done now in childhood dementia. So that's a really tragic to see someone at the very start of their life be affected by dementia. So it is something that affects us at all ages and stages throughout the lifespan, and as you rightly point out, is not something that is solely limited to people over the age of 65. Whilst aging is probably the highest risk factor, it's certainly not a normal part of that aging process, and it's not limited to that group.
So, David, how do people get diagnosed with dementia? What's the process?
So there's a couple of things with this, and probably worth mentioning too that one of the great challenges for getting a diagnosis is identifying that things are changing and what that might be due to. Because it can be around things like being able to make a decision, some memory issues, some changes in behaviours, changes in mood, changes in sometimes that's misunderstood as someone might be, have anxiety or depression or other things. Um, so it really is important to get a timely diagnosis, to talk to your GP, and look, sadly, not every GP is well versed in this piece, um, which is why we've developed what's called the BrainTrack app. And anyone can download that from the App Store. I think we're up to about 100,000 downloads of the app now. We've developed that using gaming technology. We developed it during COVID, so it's actually based on on travel. So you're asked to go to particular countries, prepare for that, do some planning around that. So that's all your executive functioning piece. Recall who's in your travel group. Remember what your luggage looks like. So it's done in a really fun way, I'll say. But what sits behind that is we've looked at a lot of the cognitive screening tools that exist, and have sought to incorporate it into this. So it's not a validated, reliable cognitive screening tool. So let me stress that. But it does give people an indication of brain changes, or areas where there might be concern about your brain functioning. And it does enable you to produce a report at the end that you can give to your GP. So, and I think one of the challenges people have faced in the past is you go, oh, worried a bit about this or that, and without having a bit more substance to it, the GP can be lost as to whether that's something to be concerned about anyway. So we certainly hope that delivering to um, the consumer or the patient more information will help them in that conversation with their treating practitioner. And then once the GP can then do a number of things. They can do what's called a mini mental screening piece themselves. They can refer to a specialist like a geriatrician to undertake that. There are places, and certainly Perth is one of those, where you have PET scans. So you are able to do scans of the brain, which particularly in things like diagnosing Alzheimer's disease, which is the most common form of dementia, recognising there's over 100 different types of dementia, with Alzheimer's being the most common. That can be picked up through amyloid buildup in the brain. So in scanning the brain using a dye that basically sticks to the amyloid, that can pick up levels of amyloid in the brain. The only challenge with that, as it stands, is there are people who can have high levels of amyloid in the brain, but not develop symptoms of dementia. So it's not a guaranteed indication, but it's the closest thing we have at this point in time.
So, are other things that we could do to maintain our well-being, which may obviously it's not there's no cure for dementia, and
Yep.
we don't foresee there being any curative intervention in the near future, could be involved in, I guess, slowing down the prevention of the disease or potentially stopping someone from developing a dementia diagnosis or a dementia disease.
Yeah, and whilst there's no guarantee with any of the things I'm about to
Yeah,
mention, certainly the research shows that they can play a significant role in reducing your risk of developing dementia.
yeah,
The first one, and a standout, is regular physical activity, so that you really are. This is where I say, what's good for your heart is good for your brain, because we know that plays a big role in risk reduction. So if you did nothing else but physical exercise, that's probably the biggest one. Um, Obviously, a healthy diet, the Mediterranean diet is the one we tend to suggest about. Obviously, again, what's good for your heart is good for your brain. Um, and as part of that, obviously, maintaining a healthy weight. There are associations with obesity and dementia through certain studies. Not smoking, and uh, reducing alcohol intake to moderate levels, again, are things that really can help with your risk reduction approach. The other thing we say is brain health. So, obviously, if you're riding a bike, wear a helmet. Obviously, there's a lot coming out now about contact sports, and the extent to which repeated head injuries can be a major contributing factor to developing dementia. And a lot of the sporting codes are getting increasingly focused on what they do about that, not just at the competitive levels, but also at the junior levels, to really make sure we are looking after our heads when we're in the context of those contact sports. So there's a whole host of those things. There's the more information on our on our website, dementia.org.au, where people can read up more specifics about how much exercise and the rest of it to really reduce that. But that's something that's in the hands of all of us. And we also know that the foundations for dementia are laid in midlife, which is why a lot of the treatments that are available currently are really often occur too late, because obviously they're at the point where someone is symptomatic. So it's the challenge for us is diagnosing early, well, ideally preventing it or reducing our risk of it, diagnosing it early so that where there are interventions that can occur much earlier as well. So that's where much of the research focus is really seeking to really drill down on now. And there is probably more progress around the diagnostic piece with blood biomarkers, and that will be the challenge for our community and all of us, that we want to know that we have a condition that there is no treatment for.
Yeah, yep, certainly opening up a can of worms with that last statement you just had there, David. Do you want to know if something's going to happen if you can't prevent it, or you can't necessarily cure it? Yeah,
Correct.
absolutely.
Yeah. So that'll be a major. I think that'll be probably the first major challenge for us for a period of time until there are some treatments available, because most of the treatments you'll hear about now, with all the different lecanemabs and all the different mabs, as we call them in short, are disease modifying, but they're not. They're really treating the symptoms, not obviously the cause.
Wonderful. Thank you so much for your time, David. Is there any closing remarks? Any
Thank
takeaways that
you.
you
Look,
have?
I think certainly I'd encourage people, if they've got any concerns at all about either themselves, others living with dementia, or you just want to improve how you can better support people living with dementia, our National Dementia Helpline, 1800 100 500, operates 24 hours a day, 7 days a week. Some of the team are based in Perth for that reason, to make sure we've got that 24-hour coverage. So really encourage you to do that, or go to our website, dementia.org.au, for more information on how you can help contribute to making our world more inclusive and supportive of people living with dementia.
Thank you so much, David. And just to champion David and his work even more, Dementia Australia has some fantastic e-learning and learning packages for health professionals and members of the public if they did want to access those. As David has alluded to, it's an insidious disease and that is going to increase in prevalence in our society greatly, doubling almost in early onset and overall dementia diagnoses in the next 30 years. PaSCE offers a variety of educations for not only people with a dementia diagnosis, but also any life-limiting illness, so that we do have our own relevant educations. Please consult pace.com.au. It's been a pleasure interacting with you, David, and everyone else out there. Thank you so much for your time.
Thanks, Timothy. Thanks, listeners.
All the best. See you on the next one. What other strategies